Welcome back. If you're following along in the suggested order of these videos, then you now have your bars in. Congratulations, you've made it through the toughest part of this entire process. So now we can start working on building yourself back up. So obviously things are going to be a little bit different in the next 3 months and moving forward now that those bars are actually in. You're going to start to notice different positions that are really painful to be in and different places that you don't want to get to. And that's something that you're going to learn as you go. So that physical pain is something that's going to be with you every day. It's not necessarily going to be excruciating, but it's going to be enough to get your attention, and use that pain to really see where your limits are. Don't try to push through these right now. It's just going to take time to heal, but really pay close attention to what those limitations are and gradually start to work those further and further as we get going. So as you incorporate more of these movements back into your routine, you're going to be hit with those limits, those walls, and they will start to recede over time, like I said, but just take it easy and be patient. So for the next 3 months, we're going to be working primarily with lower body work, body weight only, and cardio. So this is all going to help build you back up so that when we are ready to start incorporating weights back in, you're going to have a nice solid base to work from. So you're not going to want to be using your arms a lot when you're sitting, standing, all that good stuff. So we want to build up as much leg strength as we can by using your body weight with what we can already do. So month 1 of this post-op program is totally, completely optional. So that's the first 4 weeks. No matter how good you feel, you're not going to be doing any additional activity the first 2 weeks. And then in week 3, if you are feeling good enough, you can start to incorporate the very minimal activity that's listed in the plan. But again, this is going to be nothing crazy, nothing that you would even really consider a true workout, but it's just a little bit of movement to get you back into it. But again, the first 4 weeks, totally optional, depending on how you are feeling. And now I'm going to make this very clear for the rest of this 3-month block so that there is no confusion. We will be using absolutely no weights for months 1 through 3. That's weeks 1 through 12 of the post-op program. No weights whatsoever, no exception. Everything is going to be body weight and cardio. So we're not going to be adding any additional stress while the body recovers, while those bars set. We're going to allow everything the time that it needs to get into place before we continue with any additional loading. So you're going to be working to bring your volume of these bodyweight exercises and cardio up over time so that when we are ready to continue with the weights in week 13, you'll be in the best spot possible. So be sure to follow the post-op nutrition and the post-op warm-up and mobility recommendations as well, as they're listed in their sheets. There are significant changes to both of those, especially the warm-up side. So be sure to pay attention to all of that as you're going through this process. And again, we're not trying to break any feats of strength here. You're not going to be doing anything impressive. Just stick with these basic outlines and be patient as we work to get you back to the point where we're really getting into the intense exercise again. If at any time these movements start to bother you, stop. Do not do them. Come back to it next week and retry it with a fresh week in mind, because you're going to take some time to recover. Certain movements aren't going to agree with you, and it's just going to take a little bit more time for those to be workable. So again, be patient and go through this cautiously, gradually, and safely.